in the hospital. As the number of active coronavirus cases trends up, some are wondering if North Dakota can handle a potential increase in hospitalizations. KX News reporter Robert Sir sat down with leaders of both health systems locally to separate fact from fiction.
We've all seen the national reports of full or overcrowded hospitals across the entire country. We've even gotten stories like that from viewers like you here at KX. So what is the truth regarding the state of hospitalizations here in the Bismarck-Mandan area? Well, I went to the two largest providers to get that answer.
CHI St. Alexius CEO Kurt Schley tells me the hospital currently has 13 people hospitalized for COVID-19. 4 of those are in the ICU, with 1 being on a ventilator. That's well under CHI's limit of 16 ICU beds, and they have around 130 at the hospital for one reason or another. Schley says the hospital is also doing a good job at keeping its workers healthy.
We have about 24 employees right now that are in quarantine due to exposure. The vast majority of these are through community spread.
He adds while employees are not regularly tested, they are screened frequently and can stay home if they have any symptoms.
Widespread COVID testing has not taken place yet because of the supply of the COVID tests and the capacity of the labs in our area and also nationally to be able to process them in a timely fashion.
At Sanford Health, the numbers are quite similar. 17 people are currently hospitalized for COVID. All 4 people in the ICU are on ventilators. But Sanford has room for 15 ICU COVID patients and over 50 ventilators ready to go. And if they push the panic button, they can have around 180 rooms ready to treat COVID patients in a short amount of time. KX News has been contacted by several viewers claiming to have been turned away by Sanford or transferred to another location in Fargo or Sioux Falls. I took those concerns to Sanford's Vice President, Todd Schaefer.
We would never close our doors to people coming in to seek care, whether it's COVID related or general medical related. We've been operating at a very high level, high capacity for 2 years. So this isn't anything new to us. We find a way to make sure that each and every patient that presents to us for care gets the care that they deserve.
He adds that patients are only transferred if they can be better treated at another Sanford hospital. I did reach out to people who made the claims but have not received any follow-up calls. Schaefer stressed that the COVID pandemic is an extremely fluid situation and things can change drastically on a daily basis.
We could go from a completely full unit, looking at opening the next unit and preparing that to accept more COVID patients, to 2/3 empty, all in a 24 to 48 hour time frame.
But for now, both leaders say their hospitals are far from capacity and equipped to handle the ongoing pandemic. Reporting for KX News in Bismarck, I'm Robert Sir.
And both leaders we spoke with tell KX News they are doing their best to make sure frontline healthcare workers don't get burned out, which could lead to mistakes being made. For the latest information on the coronavirus, including resources, all of those latest case numbers in prevention, head to kxnet.com.